Hello, we are here in beautiful Beirut, Lebanon for the World Allergy Organization 2019 WIS Conference that's co-hosted by the World Allergy Organization and the Lebanese Society of Allergy and Immunology. We've been meeting and hearing wonderful lectures on key cutting-edge developments in allergy and immunology. And here with me today is one of those prestigious presenters, and that is Dr. Anne-Marie Irani. Thank you very much for meeting with me today. And I've asked her to share with us a topic that she has presented and some of those key findings. What topic have you chosen to present to us today, Anne-Marie?
So one of the conditions that we deal with is atopic dermatitis, eczema, and significantly severe eczema.
And what I would like to ask is, what is the key development, both in diagnosis and management, for atopic dermatitis from your perspective?
So my presentation at this meeting actually has to do with biologics for the treatment of atopic dermatitis. And anyone who treats this condition knows that it is a very difficult condition to treat in severe cases, and for a long time we really have not had new developments.
And for these new developments in biological treatment, how does that affect the patient?
So we actually have finally one of these new biologics that has been approved in the United States for treatment of patients aged 18 years old and over. And that is dupilumab, and it has resulted in very significant improvement, both in the control of the skin rash, but also in the control of the itch, which is one of the most difficult things to control in atopic dermatitis.
And if you had to have a take-home message for allergists and primary care in terms of dealing and prescribing biologics, what would be that take-home message?
So I think this is a perfect example of why all of us allergists and immunologists really need to stay up to date with the science of our field. These new developments would not be possible if we did not really understand the underlying mechanism that lead to the severe inflammation. So understanding those mechanisms are going to make us much better physicians and able to prescribe these new biologics that are based on the underlying inflammatory condition.
And where do you see the research heading over the next 5 years? And if you had an unlimited budget, where would you put those dollars in research for atopic dermatitis?
So in addition to the one biologic that is currently approved, there are about 6 or 7 that are currently in development. And of course, in the future, what will be important is to understand better which of these medications works for which patients. One of the themes of this meeting has been precision medicine, individualized, personalized treatment. And so the future would be in really understanding the correct biomarkers to identify the right patient for the right medication. And of course, being a pediatrician myself, I think it's very important that we do the research in the pediatric age population and develop the treatment approval for this age group as well.
Thank you so much, Anne-Marie, for meeting with us today.
It was a
really
pleasure.
enjoyed it.
Thank you.